Hello and welcome. My name is David Antliff. I'm a clinical senior lecturer and honorary consultant in critical care at Imperial College London, and I'm the chief investigator for the embedded SepTiC mechanistic study. And in this video, I'm going to explain and outline the principles of the SepTiC study.
SepTiC is an embedded mechanistic study funded by the National Institute for Health and Care Research EME programme. It stands for the Fluid Strategies and Inflammatory Phenotypes in the SepTiC trial study. Within the fluid domain of the SepTiC trial, patients with sepsis will be randomised into one of two groups. The first group will receive a fluid strategy based on standard of care, where fluid will be used in the same way that it is in standard clinical practice. The second group will receive a more conservative fluid approach, using less fluid and removing excess fluid with drugs called diuretics. However, we suspect, based on research that has been carried out in severe respiratory failure, which can occur as a complication of sepsis, that patients may respond differently to these two interventions, depending on the amount of inflammation that they have. As such, in this study, we plan to take a blood sample from patients at enrolment into this domain and measure a panel of markers of inflammation, which allow us to separate patients into those with higher and lower levels of inflammation. We'll then be able to look within the trial data to see if these two separate groups of patients behave differently with the two interventions that we're testing. The hope is that in the future, by knowing how much inflammation that a patient has, we'll be better able to target the optimum fluid strategy to each group of patients and overall improve clinical outcomes from sepsis. Thank you for considering taking part in the SepTiC mechanistic study. If you've got any questions about this part of the research, please contact the trial team.